And action. All right, so hey everyone, we're going to run through a medical scenario for you. I'm going to be the student. This is my partner Nick. He's going to be the tester. And he's going to run me through it. Now I do know what the scenario is. However, I still have to go through and get the points correctly, just like you will have to on your exam. And I had to go through it. Nick had to go through it. So this is how we're going to do it. All right.
All right, Colin. So you're dispatched for a 32-year-old male at a soccer game with a chief complaint of shortness of breath.
Okay. So BSI is my scene safe.
You have a large drunk crowd of soccer moms.
Oh, geez. Yeah, I want police there. Code 3 to help control the crowd.
Okay.
And you said this is for
Shortness of breath.
shortness of breath. I might call in while we're at it, think about additional resources. We might get ALS moving pretty quick too. Is ALS available?
You do have additional resources available to you. You have PD, fire department, and also an ALS rig, which is 30 minutes from the scene.
Ooh, okay. That's a bit out there. Okay. Well, we'll get PD there to help control the crowd of drunken soccer moms. Is my scene safe once they arrive?
Your scene is now safe.
Okay, so I'm going to enter my scene. What is my nature of illness? This is a shortness of breath call?
Correct.
Shortness of breath, okay. And just one patient?
You have one patient.
Okay. And I know we've got our additional resources of the police. We do have ALS en route, but they're 30 minutes away. Given this a shortness of breath, I might call fire department in there as well.
Okay.
To help me and my partner. Any trauma going on?
No trauma indicated.
No trauma. So I'm going to consider taking C-spine, but it doesn't sound like we need to take C-spine. And what's my general impression of the patient?
As you approach your patient, you find a 30s male, and he is standing tripod in the tripod position with his hands on his knees on the side of a soccer field.
Okay.
He's wearing a player's jersey and appears to be struggling to breathe.
Okay, so we can probably assume he was playing in the soccer game. Okay, and it looks like he's having a hard time breathing. Okay, I'm going to assess the patient's level of consciousness. I'm going to walk up and introduce myself. Hi, sir, my name's Colin. What's your name?
My name's Nick.
Nick, what's going on today, man?
I can't breathe.
Can't catch your breath?
Yeah, I think I'm having an asthma attack.
Okay, all right. You have a history of asthma?
I do.
Okay, so Nick's chief complaint is he's feeling like he's having an asthma attack and he feels like he can't breathe. Nick, a few dumb questions for you. Do you know what day it is?
It's March 23rd.
Wow, that's really good. It's March 23rd. Okay. Do you know where you are right now?
I'm at my soccer field.
Okay. And do you know, person, place, time. Soccer field. You know where you are. You know what day it is. You know about what time it is tonight?
It's about 8 o'clock at night.
8 o'clock at night. Okay. And what big event is going on in the sports world today?
The NFL draft.
So my partner or my patient, my partner is alert and oriented times 4. My patient is ANO times 4. What kind of behavior are we seeing on him?
He's pretty panicked.
It's pretty panicked. Okay. So ANO times 4 and it says his name is Nick. So we have our chief complaint, shortness of breath. He's ANO times 4 with kind of panicked behavior. He's in that tripod position. I'm going to assess his airway. It appears to be open. He's controlling it. I'm going to assess his breathing. What's the rate and quality of breathing?
He's breathing at approximately 40 times a minute.
Ooh.
They are rapid and shallow breaths.
Okay. I'm going to listen to lung sounds as well real quick.
Wheezing in all lung fields.
Wheezing, okay. I'm going to begin oxygen therapy. We're going to give him a non-rebreather mask at 15 liters a minute. Does he accept that mask?
He tolerates the non-rebreather.
Okay. Now I'm going to assess circulation. I'm going to feel for a radial pulse. Does he have a radial pulse?
He has a rapid radial pulse.
Rapid radial pulse, okay. And what's the skin color temp condition look like?
He is pale and clammy.
Pale and clammy, all right. And I know you said
with cyanosis around the mouth.
So he's pale and clammy and some cyanosis, okay. Now I know you said there was no trauma involved, but I'm still going to look for any kind of signs of bleeding or trauma that I see now. Do I see any kind of trauma or bleeding?
There is no evidence of trauma upon a rapid assessment.
Okay, I'm going to make my, I'm going to kind of rate this patient's priority. He seems like he's critically ill with this asthma attack. He's in that tripod position, breathing that fast. I'm going to direct him to the back of the ambulance rapidly so we can further assess and treat him. So I'm going to say, hey, Nick, why don't we get you in the back of the rig and let's try to help you breathe. Let's try to help you breathe better. Once in the back of the ambulance, I'm going to direct my partner to start working on a full set of vitals while I continue my assessment with him. So I'm going to say, hey, Nick, what were you doing when this all started happening?
I was just running down the field during the soccer game.
Running in the soccer game. Is your asthma triggered by running?
It is.
By exercise? Okay. All right. Does anything make your, oh, I'm sorry. And so this just started happening recently?
It did, right before we called.
Right before you called, you were running down the field and the asthma attack kicked in. Okay. Has anything, obviously, it's worse with exercise. Do you feel better with not exercising, like when you slow down to get better?
Yeah, when I was kind of propped over, it made it feel a little better. And so, as well as this oxygen, I think it's helping.
Okay. So rest and the O2 is helping. Okay. And it feels like you just can't catch your breath. Feels like an asthma attack.
Yeah, lots of pressure.
Okay. And on a silly 1 to 10 scale, if we could rate the severity of this asthma right now, how you're feeling right now at a 5, how would you rate it when it first started compared to right now?
It was about an 8.
About an 8. So that oxygen is really helping you. Okay, I'm going to ask you a question here in a minute. Again, after we help you out. Do you have any pain anywhere?
No pain,
No
just
pain,
pressure.
Just pressure.
It just feels real tight.
Yeah, real tight in your chest. Okay. You said it was about a 5 out of 10, 8 out of 10 at onset. Okay. And okay, that's about the time. So just so I know I got your story correct, you were running down the field maybe about 5-10 minutes ago when you had a sudden onset of this asthma attack, and you do have a history of asthma that's induced by exercise.
Correct.
Okay, cool. And real quick, are you allergic to anything at all?
Penicillin.
Penicillin, okay. And do you take any meds every day?
I do. I have Advair
Okay, Advair.
and my rescue albuterol inhaler.
Albuterol inhaler, okay. Do you have that with you?
I do not.
Oh, okay, no albuterol, because if you had it with you, I could assist you with that. But of course, since you're exercise induced, you don't have it with you.
I got my Advair discus, but I don't have my albuterol.
That Advair discus isn't going to help you much right now. You got, of course, you brought that with you. You long acting. Okay, and the medical history, just some asthma in the past.
Yep, and I have been intubated.
You have been intubated from an asthma attack.
Correct.
Ooh, that's not good. Okay. Okay. And last thing you ate, it's not really important.
I had some Gatorade.
Gatorade. Okay. What about food?
Some oranges.
Oranges. Okay. Okay. Do we have those vitals back from my partner?
You do.
Okay.
So you have a current blood pressure of 136/82.
Okay.
Your heart rate is 130.
Okay. All right, 130.
Your respiratory rate is 40, rapid and shallow. Your oxygen saturation is 89%.
Was that at room air or is that with the oxygen?
That's room air.
Okay, that was our room air reading. I should have gotten that earlier, but thank you so much.
It's currently 92% on oxygen.
Okay, that's better. Okay, what about, let's throw some N-Tidal on him.
You're currently sitting on oxygen post-treatment at 50.
50, okay, it's a little high, but not horrible. Okay, and then, since he's running around, I'm gonna have you get a blood sugar as well.
Your blood sugar comes back at 88.
88. And you said those lung sounds were pretty wheezy.
They were wheezy all over.
Okay.
Correct.
So I got a differential going. It really sounds like this is an asthma attack. You weren't stung, you didn't get kicked in the chest, anything like that. Nothing happened before this, and this feels like your asthma attack. I'm gonna get on the phone with medical control. And I'll let them know that I'm gonna call Mercy Hospital and say, hey, Mercy, can I get a doc for medical control, please? And you're gonna be my doc. Sure. So I say, hey doc, my name's Colin. I'm an EMT with Alina. I'm on scene right now with a 32-year-old male. He's a soccer player. He's playing the game right now. He's having an asthma attack, and he does have a history of asthma that's induced by exercise, and he didn't bring his inhaler with him. Now, I do have an albuterol nebulizer, but I do need orders in order to give that to him. Real current, quick list of vitals, 136/82 blood pressure, heart rate 130, regular strong. Respirators are 40, shallow. Room air was, SpO2 room air was 89%. We do have him on an mounted breather that's at 92% right now. And he says he does feel better with that. N-Tidal's at 50. Can I go ahead and give him this neb?
Yeah, go ahead. That sounds appropriate. Go ahead and administer 1 albuterol nebulizer. Reevaluate.
Okay, and that's 2.5 milligrams albuterol, and we're going to give it with 6 liters of oxygen per minute. So I'm going to administer that, and well, Nick, I'm going to give you this neb. You know how to take nebs. I want you to really breathe that stuff deep and try to hold it as deep as you can for a few seconds and let it out. I want you to tell me if you start to feel better with that. So after about 5 minutes, 2, 3, 4, 5 minutes, I'm going to ask him, hey, Nick, how you doing with that neb?
Feeling a lot better.
Feeling a lot better, okay?
Lot better.
I'm going to reassess those vitals, and I'm going to reassess those lung sounds.
Your secondary set of vitals come back at 130/80 for a blood pressure, heart rate of 120, respiratory rate of 26, oxygen saturation still holding at 92%,
okay,
with an end tidal of 50.
Okay, very good, not bad. All right. So, Nick, it's good that you're feeling better with with the nebulizer going. I'd really recommend that, since you do have a history of asthma where you were intubated, that we still do get you into the hospital, especially because you don't have your emergency inhaler with you right now. Really think we ought to run you up to Mercy Hospital and let them help you out, and I might call back for another neb on the way. That sound about right?
Sounds good.
Okay, let's not have you intubate again. So during transport, I'm going to reassess Nick every 5 minutes with a physical assessment and a reassessment of vital signs. I'm going to reassess how he's doing with that neb. If it does take too long, during transport, if the neb runs out and he continues to have difficulty breathing, I might call the doc back and ask for a second neb as well. And that's what I got.
Okay. Is that all you have, Colin?
Oh God, I hate that question. It's the worst. Yes, that's all I'm going to do for this patient. Did I miss anything?
Your end time is 22:15.
Nice, man. So there you go. There's the assessment. Did you see how we left out, or I left out, all that extraneous, no, okay, BSI, I'm going to put my gloves on and I'm going to put my gown. Not a lot of extra words, just straight to the point. Asked my questions, knew what I wanted to ask, and I got through it. How long did that take? Oh, I can probably see here. Let's pause it. Okay, well, I can't see how long it took, but that's how you do it. That's a decent example of how we're going to run through that. I'll post this up on D2L on my YouTube channel for this. Nick, do you have anything for me?
Oh, good luck.
Yeah, we've all been through it. And then what I will do is I'll also write up the narrative. I'll do a video where I'm going to write the narrative, because this is your this is one of your scenarios. So I'm going to actually write up the narrative for you. And I'll do that with you for this station. So, all right. See you guys later. How do I stop this? That point? No, we got to be awkward with them.
Be awkward. You're good at that.
Really good.